Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 76 cases of COVID-19 in Windsor and Essex County. Please note that due to a system issue yesterday, 33 of these cases are from the 16th, with 43 new cases being reported today. Of the 76 cases, 12 are close contacts of confirmed cases, 14 are related to outbreaks, 14 are community acquired, 2 are travel related, and 34 cases are still being investigated. We have had 12,682 cases since last March. 11,999 cases are now resolved and 328 people are active at this time. 43 confirmed cases are currently in the hospital and 10 people are in ICU. Our community has lost 355 people to COVID. 228 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 11 active outbreaks in Windsor and Essex County. 6 are in long-term care and retirement homes, 3 community outbreaks, and 2 workplaces are an outbreak. In addition, to provide an update regarding the schools, to date we have 4 cohorts, approximately 80 staff and students, dismissed due to high-risk exposures in both elementary and secondary schools in Windsor-Essex. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. As we plan for mass immunization clinics for broader distribution of the vaccine when it becomes available. If you are a healthcare worker, please visit our website at wechu.org and search COVID volunteer if you would like to volunteer at a mass immunization clinic. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick, limit your close contacts to your household members, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us this morning. Over the weekend, the Medical Officers of Health and the hospital CEOs received a memo from General Rick Hillier, who is the chair of the Minister's COVID-19 Vaccine Distribution Task Force. The memo talks about sequencing of phase 1 priority population for vaccination with vaccine supply resumption. As we know that the vaccine supply has been is back online again, and we are getting more vaccine, regular vaccine of Pfizer, and also anticipating more supply of vaccine in the coming weeks. Based on that memo, the immediate priority for the first dose vaccination continues to be the staff and essential caregivers in long-term care home, retirement home, and First Nations elder care homes, and any residents of these settings that have not yet received a vaccine, a first dose of vaccine. So if you are staff, if you are essential caregivers, designated essential caregivers in the long-term care home, retirement home, if you haven't received the first dose of vaccine, if you want one, please register with your home to get your vaccine in a timely manner. The second group is the alternate level of care patients in hospitals who have a confirmed admission to a long-term care home, retirement home, or other congregate care home for seniors. If you're waiting for a placement in the hospital, we are working on a plan to start vaccinating them in the hospital and also ensuring that we can provide them a second dose in their home if they move to their home before getting their second dose. The logistics of these of vaccinating, especially the second dose, is a challenge because we cannot mobilize the vaccines once it's thawed, and we also don't want to waste any doses of vaccine if we only have 1 or 2 people in the home. So the logistics of arranging that is somewhat challenging, but we are working on it to make sure that we do that. The third one is the highest priority healthcare workers, followed by a very high priority healthcare workers in the region. and then Indigenous adults in northern, remote, and higher risk community. When we're talking about the highest risk healthcare worker, these are the highest risk healthcare worker identified by the ministry document, including all hospitals and acute care staff in frontline role with COVID-19 patients and are with a high risk of exposure to COVID-19. These are the people who are mainly taking care of suspect or confirmed cases of COVID-19 in the hospital system. All patient-facing healthcare workers involved in COVID-19 response, which may go beyond the hospital system, including assessment center, including any kind of COVID response team that are providing direct care for COVID-19 response. And then among the other highest priority is the medical first responders, and followed by the community healthcare worker serving specialized populations such as needle exchange program, the Southern Ontario Aboriginal Health Access Center, home and community care healthcare workers caring for recipients of chronic home care, and seniors in congregate living. Those are the classified as the highest under the highest priority for healthcare workers to receive the vaccine. There are other criteria which puts people at a very high priority for receiving the vaccine. So as soon as the sequencing and if we have enough vaccine, the other healthcare worker that are under very high priority includes the rest of the acute care and other hospital setting, which is the patient care areas that not necessarily involved directly with COVID, but would be involved with patient care. We're also talking about the congregate settings, the healthcare workers who are working in the congregate settings, such as assisted living, correctional services, etc. And then we are talking about community care with high risk of exposure and serving specialized population. So there's a long list of this document, which maybe many of you are aware. If you are the lead for any of these agencies that are identified as the highest healthcare worker prioritization or the very high priority, make sure that you start developing your list. We will be connecting with you along with Windsor Regional Hospital to start scheduling these healthcare workers for the population. Outside of the healthcare worker, the next priority for first dose vaccination includes adult 80 years of age and older, staff and residents and caregivers in the homes, retirement home that are not vaccinated, and healthcare workers in the rest of the priorities, including adult recipients of chronic home care. So we are working on to get the first priority done based on the sequencing, and then you will hear more from us in the next coming days about the adults 80 years of age and older, that how we will start vaccinating them. So Windsor Regional Hospital already received a supply, or anticipating a supply of the next dose of next phase of Pfizer vaccine in a day or two. It was delayed because of the weather, but as soon as it's available, we'll start completing the rest of the population under the highest priority that's been identified by the ministry, and then move on, continue to work with the rest of the healthcare worker prioritization and the adults 80 years of age and older population in our community. Thank you.
We'll now take questions from the media. Today we'll start with AMA 100.
Teresa, just looking at the numbers, and for community today, that's 14. We haven't had that number in quite some time, that high for community spread. Any concerns there?
Well, there's always concern when there's community spread, because that means it's in our community and that it's not linked to a high-risk contact, which is what have been the majority of our cases so far. We do know that we have some significant outbreaks as well in the community, so the numbers are higher than they have been the last little weeks, or the last week. So it is concerning as things open up, but you know, all the public health measures are still in place, and we do ask that people really adhere to what we've been saying all along to protect themselves and to prevent the spread of COVID.
And I'm not sure if this is for Teresa or Dr. Ahmed, but I noticed there is an outbreak under community for Salvation Army. Is that linked to the downtown mission at all?
Well, some of their population basically go from one place to another. So that's how, based on the investigation, it may show up as two different sites, but because of the population visiting those two places. That's how it's connected, and that's how we are managing it right now.
When it comes to the outbreaks at the Downtown Mission and Salvation Army, just wondering how difficult is it to implement like quarantine measures for these individuals?
It is extremely difficult. I think we'll have to take all the way back to step one, that this is a very at-risk population. This is a vulnerable population. They have much higher risk of contracting COVID because of how they live. And when they're coming to these type of shelters for support, they're also in a situation which is not the ideal situation. And then the shelter owners and operators also have a challenge in enforcing many of these public health measures that we are expecting others to follow, which includes physical distancing, which includes making sure that people are adhering to some of these restrictions, such as wearing a mask, etc. So that's the challenge. We work with the Downtown Mission for quite some time now in providing them with the tools and resources to have all of these things in place. So that's number one challenge. Number two challenge is not having the complete picture of who these people are and whether they provide all the information for us to follow up with them to get to the case and contact management. And then the third step is when we are getting a positive test, where do these people go? What kind of isolation is needed? The city of Windsor obviously has an isolation site specifically for this population, but it has a capacity. So we are, I believe we are at capacity at this time. And the challenge is what happens if we get more cases and how do you isolate them? So our team, including myself, we've been working very closely with all the health system partners, including the Downtown Mission, to provide them with some alternative solutions and looking at different sites that how they can still use some of these sites to do the proper isolation and do a good job in preventing any further spread, but recognizing that this is a very difficult population, very difficult to track down, very difficult to collect some of that information. And then once you're positive or once you're identified as a close contact, adhering to the public health measures will continue to be a challenge. So we're hoping that with some of these measures in place, we'll get it under control and keep everyone safe.
And one final one just on that topic. Do you have an updated number on how many confirmed cases are at the Mission and Salvation Army?
Just give me a second while I try to find that information. I had it. So we have a total of at this I think this was the update yesterday that we had 54 cases in total, and then we got some additional cases. So the total case count so far as of yesterday, it was 65, and that includes a combination of the guests as well as the staff of this facility.
Thank you.
Any questions from CTV?
Yes, good morning. Even though the region just entered the red zone, do you anticipate that we would be able to move to orange soon, or how long would you like to see the region in red before restrictions ease?
So I think if we go with the implementation of these measures, and I've said this before as well, that it typically takes 2 weeks to see the impact of any easing of the restriction, that whether it is leading to stabilization of cases or reduction of cases or increase in the number of cases. So at least 2 weeks, and then depending on the number, I think we'll have to go back and see whether these measures are working, whether we need to stay at the same level or maybe further easing of restriction is warranted. So at the minimum, I would say 2 weeks, but it can be longer depending on how the cases continue to come.
Okay, and the province said that school boards will be required to test students and staff in 5% of schools, do you think this is an effective way to gauge the virus level in schools?
Well, it's a strategy that the province is putting forward. I'm not necessarily these asymptomatic testing, whether it would result in getting some of these I guess picking up some of these cases early would be helpful or not. I'm not there's not enough evidence to suggest that. So I think at this point, that's the direction that we have received from the ministry as well, and then we will be working closely with our school board partners to get some kind of system in place, a plan in place that how we would achieve that target to meet that requirement, and also to give the level of comfort that people are looking for with these type of testing. These testing will continue to be voluntary testing, so you have to recognize that this would be a voluntary testing, and you're talking about little children that need to be swabbed just on a voluntary basis. So I'm not sure that what would be the uptake of that. When it comes to someone with symptoms, they have to go to the assessment center to get tested or arrange testing in a different way. So that's not the population that I'm concerned about. I think they should get their test as quickly as possible. But for a child who doesn't have any symptoms, and if they want to get tested, what would be the uptake of that? We'll have to have that discussion. We'll have to see how practical it is, and working with the school board, if we have the rest of the system in place, we'll have to see that what will be the uptake in the community too.
Okay, thank you.
Any questions from Blackbird?
Yes, good morning. I know you mentioned that more information will be coming in the coming days, but as you're moving on to the next phase, the seniors 80 and over, is there any action that they need to take at this point to make sure that they are on a list, or that they will be considered for a vaccine?
No, that's a great question. We were waiting for the provincial solution to provide us with the information that we can use some kind of a booking system for the community, that people can either sign up online, or maybe looking for a much bigger solution for the rest of the province, rest of the regions. And we are slightly ahead of the curve in terms of our reach and the population that we have covered. We have vaccinated 90% of all our residents in the long-term care home and retirement home. We have got a significant number of healthcare workers already covered. So we want to make sure that we are also providing the same level of coverage and support and protection to our seniors, 80 years and older. And we want to get it done as soon as possible by looking at all the resources available to start registering them, start organizing their clinic based on the vaccine supply. So stay tuned. Next week, hopefully we should be able to share additional information for these people to start contacting, or us contacting them. There are a number of options that we are looking at. We are also considering our primary care providers to maybe share that information from their rostered patient to us, and also with the pharmacies, if they can share that information with us of all the people who are 80 plus. And once we have that list, there will be some kind of system to reach out to them and then start enrolling them for their vaccine.
You also mentioned the need for volunteers for mass vaccination clinics. Are you looking for like nurses, healthcare professionals? What kind of volunteers do you need to make those run smoothly?
So right now we are working with all the municipalities in determining sites and locations for the mass immunization clinics. And internally, we do have nursing staff, RPNs, RNs, nurse practitioners, that will all be working at these sites. So we do have a very good complement of vaccinators and people to work at the sites. However, depending on the volume of the vaccine and the number of sites operating at one time, we are asking for healthcare providers or people with a medical background, that would be, physicians, nurses, to go to our website and search COVID volunteer, and it'll bring you to like a little application process, a little registration, and then we follow up. All along, we have been getting lots of interest in helping with COVID throughout the whole pandemic, and our HR department has gone through the number of people that have offered their services to see if there's a good match. And so as we're moving forward, we did put the link on our website to continue to have a kind of a dedicated place where people could go. Right now, they've been just contacting our health unit and sending emails, and so it's just having it all in one central place. But right now, you're right. We're looking for people with a medical background.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Correct me if I'm wrong, but you said you expect a steady supply of Pfizer. Does that mean that at least during this first priority group, the individuals who you're looking to schedule for vaccines will have to visit the sportsplex?
So I'll start, and maybe Teresa can add. So that's the challenge. I think what we are hearing the news that Pfizer supply will be much more steady, and the requirements for these Pfizer vaccine is not easy. And the ministry, with limited supply of Moderna, they want to use it to in areas which are more difficult to reach, and with the resources and everything. So the allocation, we are still not sure that how much of Moderna we will get. We do know that how much of Pfizer we are getting, at least in the next 2 to 3 weeks. So we have that information, and that's why we are working with Windsor Regional Hospital to make sure that we are looking at all the options. One option could be that they all come to the sportsplex, and that's where we get the vaccine. We're also working with our municipalities to set up those mass vaccination sites, even at a smaller level, not that as a high level, and to start to reach out to some of these population through those means. So not to say that they will all go there. Even if they go there, we'll have to look at maybe an alternate timelines just to make sure that they're not coming in close contact with a healthcare worker who could be at a higher risk. So even if that has to happen, it has to be at a dedicated time rather than everyone coming together at the same time. I don't know, Teresa, if you want to add anything.
Nope, just that we continue to work with our partners, but also looking at the individual needs of our residents, those that are over 80. And we are excited to be able to offer this when the vaccine's available. It is not here yet, but we do anticipate it will come, and likely will be Pfizer. And we are working with adult recipients of home health care. So we know that those are two groups that we may want to work more closely in each municipalities to make sure they're all vaccinated, depending on the vaccine supply. So the plans are in place, and we are, engaging the right people, but we still need the vaccine and a steady supply of the vaccine.
As you receive the vaccine supply, as things heighten and the mass vaccination grows nearer, are you feeling the heat, or are you confident and calm and ready to get this underway?
Well, I can start. We have been, throughout the whole pandemic, we just go from one priority to the next. And while we still have case and contact management is a key priority, the vaccine rollout is another very important, next step in fighting the pandemic. And so I don't know if we're calm. I think everybody is working really hard to try to meet all of the, anticipate all of the different needs and follow the direction of the ministry. We are on a lot of ministry calls, and we are up to date on, the vaccine, its availability, the priority list, next steps. We're working with our municipal partners. We have a meeting today's Wednesday, meeting today to talk further about the mass immunization clinics. Our nurses, as you know, we have groups of nurses that are able to go out and vaccinate on site, and they have been in the long-term care and retirement homes. We're using Windsor Regional Hospital's their sportsplex to vaccinate healthcare workers. So it's just trying to make sure that we're ready and able to receive the vaccine and distribute it in a timely manner. And all of that will come together, but it's right now getting all the plans in place and making sure, it all comes together.
You mentioned that we're going to be getting several shipments or a few shipments of the Pfizer vaccine in the coming weeks. Do you know how many doses we will receive?
Close to 4,500 doses in each shipment, but again, that can change. That's the projection, and I think the confirmation only comes a few days in advance when the vaccine actually is shipped to Windsor.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, just wondering if there's any updates, excuse me, in regards to the variant, anything come out of that?
Not yet, Rob. We're still waiting for PHO to provide with the confirmation. The genetic sequencing, it does take time, and it does require sophisticated technology. And I can imagine with the increased number of variant cases that are coming in Ontario, there may be some pressure to the system, but we haven't got that confirmation. And I will share the confirmation as soon as I get it.
Any individuals step forward after the health unit put out the potential risk exposure?
So if I'm hearing correctly, you're asking that, are you talking about like any transmission happened, or are you talking about any changes in?
Yeah.
Not to our knowledge. Yeah, no, not to our knowledge at this time. Unfortunately, I shouldn't say unfortunately. Fortunately, we both in a situation we've had the case very well contained, and we were able to reach out to them. We were able to do all the contact tracing in a timely manner. So far, we haven't had any indication that it resulted in any further transmission.
And then one final one here from a listener. With us going into red zone, this listener is wondering, is the garage considered indoor or outdoor during COVID restrictions?
I'll have to talk to my team at this time. And again, it's one of those gray area, but I would expect them to maybe make that comment rather than me trying to provide a different direction. I can, but I'll leave it to my team. Ask your listener to maybe reach out to our team, and we can provide that clarification.
Thank you.
Any further questions from CTV?
Yes, as far as the mass vaccination locations, we heard WFCU is being considered. Is there also plans in the works for a drive-through like being planned in York Region?
So at this time, we haven't had any plans to open up the drive-through. We don't have that big of a facility like the Canada's Wonderland that York has. And drive-through, it does bring its own challenges, especially with the limited vaccine supply and the target population that we are talking about. So it's not being considered at this time. In the future, when maybe the weather starts to improve and when we may have more vaccines and more ability to administer, we can look into it, but at this time, that's not under consideration.
So what are some of the locations being considered?
So we are working with our city and our county partners, and we have provided them with our data, our epidemiological data that is identifying neighborhoods in the city and the county with high incidence of COVID rates, as well as the material deprivation index, which is another measure of social determinants of health that's affecting these regions. So we have provided that information to both our county and the city partners. They are looking at it, at that data, and based on that data, they are to identify a site using that and looking at some of the municipal facilities or any other facility that they want to use for that mass vaccination site. Once that facility is identified, we will be working closely with them to set up that facility to as a mass vaccination site with the capacity that can reach out to maybe 1,000 to 1,500 vaccines a day at the minimum. So once we have that capacity, we will be working closely with the city and with the county to when we get more vaccine, to give them the resources and support to start vaccinating them. So the city and the county, they will manage the operation of the site minus the healthcare worker immunization piece. That will be supported by the health unit to make sure that the people are getting the vaccine. But the city and the county will be mainly managing these sites and working with our team to ensure that both these sites are good site based from a mass vaccination clinic, especially in the COVID times, and we'll be working closely with them throughout this process.
And would they be similar to the mass testing sites in the summer?
Well, the mass testing site was, as you recall, it was more of like a drive-through model, and this is not a drive-through model. So it would be more, having this mass, like the typical mass vaccination clinic, but based on the appointment. So people need to show up at the clinic at the time, and then they will be screened. They will be escorted to the location where they will get their vaccine. They will have that interaction with the healthcare provider, and then after going through some of the details, they'll get their vaccine. They will be observed for 15 to 30 minutes, depending on their medical history, and then they will be sent home with a reminder for their second dose appointment, and then making sure that they are coming back to the second doses. So that's the kind of model that we are looking for at this time.
Great, thank you.
Any further questions from Blackburn?
Are there any other sites active right now for vaccination, or just the Sportsplex and then going to the long-term care homes? Because there's the site downtown, there's the university site, but is that active at this point, or is that just kind of on hold for future clinics?
So the site that's downtown at the Windsor Star building is that's through Windsor Regional Hospital. So I think as they make decisions about the Sportsplex, they'll be determining if that's the site they'll be using. The other sites are not they're not up yet. We are in our plan. We are looking at establishing the sites when the vaccine, as the vaccine becomes more readily available. So you're correct. Right now, our teams of nurses are going out to the retirement homes, and they, have not been immunizing at a big site. The sites are not up and running at this time.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.